Broken is a very unique town. It's kind of in the middle of nowhere, and we service an area that basically the equivalent of a quarter of New South Wales. So that means we service a lot of Indigenous populations, a lot of property owners, and a lot of people who may not be within, say, 1,000 kilometres of a pharmacy. So when we talk about in-home services, what that means to us is probably a lot different to what it means to other people. So we deliver medication-related support to increase safety and adherence for our patients, whether that's through monitoring and adherence programs. And also we've discovered that in-home care leads to customers for life. Market research has shown that 62% of patients only use one pharmacy per year. So if you can make sure that that's your pharmacy and you go to their house, that patient is going to be yours for life. Community health hubs physically located in pharmacies can be extended to in-home services. Pharmacies are one of the most trusted healthcare professions in Australia, and one way we can build on that is the delivery of home medications and services. What sets us apart is the relationships that we have with everyone else in the community and our ability to think outside the square when it comes to solving medication problems. Part of in-home care is making sure you have enough quality staff to provide that in-home care, which in a rural place like Broken Hill often has its own challenges. We often struggle to attract quality staff to our area, so you've got to make yourself different and appealing to everyone to try and get those staff out to you. So we do some great things. We take on students, we take on a lot of interns with our relationship with the local health service, and allows us to attract good quality interns, and hopefully they'll stay on. And having those staff stay on allows us to provide services like in-home care to our patients. So if we don't change and we don't adapt to these changes, then the healthcare service market's a booming industry. So if we don't get in first, one of those big healthcare chains will. And for community pharmacies, it is an opportunity because the big change discount models aren't really built and set up to provide these services. So it is something that your regular average pharmacy with the great relationship with their customers, that's something they can really get into. And it's all about personalising that medication support for people. I mean, it might be a person in their home, it might be a person in an aged care facility, it might be a young mum with a child at home who won't stop screaming, or it might be a person who's got some mental health problems who might be too scared to leave the house. It might be something as simple as hiring a delivery driver, becoming a provider for the NDIS, and advertising those things so your customers know that you offer them. Going forward, I think it's about making friends, putting yourself out there, speaking to other health professionals, people in other areas, and it's about working together to finding out, what your customers need, what you can work towards, and kind of find that market that you might be able to get yourself into.